Hello and welcome. I'm Dr. Sonali, scientific editor for the Spark Kaho. On the occasion of World Patient Safety Day, we are bringing you a special podcast around this year's WHO theme, Patient Safety from the Start. Every child deserves a safe care. Today, we will be joined by our esteemed guest to discuss how ensuring safety right from the beginning can shape healthier future for every child. Dr. Anand Joshi is a senior consultant specializing in pediatric and neonatology at the Mission Hospital in Durgapur. Before we start, sir, I would like you to tell us something little bit about yourself and your journey as a pediatrician.
Good evening, everybody. Good evening. Thanks for the kind introduction. My name is Dr. Joshi. I'm a cricketer. Children have been always very, very passionate. So right from my MBBS time, I did my undergraduate diploma as well as my MD training in CMC Wellwood. Then I went abroad for a few years to get further qualifications. Then came back to India. Total duration of or total experience is almost 24, 25 years. I'm really thankful to my alma mater, CMC Vellore, who has ingrained quality care, evidence-based medicine practices, as well as improving nursing care, uh, right into my almost like it is there in the genes or in my roots. So, quality care is where I'm very, very passionate. This is because we are handling little small children, and if we can give them a good care, we can always have a good happy or a hopeful future, because we know that every step of their pain or stress or any uh, un, un unqualified or unprofessional behavior or a painful experience for these children can have a very traumatic lifelong consequences. So quality care or patient safety is a prime concern for me, or is one of my weak points, rather you can say, because I would like every child to have a very safe and a healthy future. That's all I can tell about myself.
Right.
So
I agree, sir. Since this year we are talking about the safe care for every newborn and every child, patient safety from the start. As a pediatrician, what does this theme mean to you?
um, as a pediatrician and as well as a personal point of view, it means a lot, because uh, I think if you look at the WHO slogan also, healthy beginnings and a hopeful future. So I think now people are more, or policymakers are more geared to see that the world is having a healthier group of adults and adolescents, so that our future can be this one. But from my personal point of view, I think we should not be. It is not about avoiding errors. It should be a some sort of a process where we can create a culture to have safety right from the beginning. Because, like what I said, every single unsafe moment will cause, whether it is before delivery, after delivery, during any time the child has been admitted, will have long term consequences. So basic point should be there should be zero tolerance for any preventable harm, or and striving for a system where safety is not an optional, but it is an uncompromisable standard.
Totally agree, sir. With this, since we are living in the era of digital technology and innovation, what strategies or innovations do you think we can do and perform for the most promise for the safer pediatric and the newborn care in the next decade or in this coming year?
Uh, we are working in a digital, or rather in a AI based ecosystem now. So I think the whole process will be now AI driven, or digital data driven. So it is, we have to be very, very tech savvy. So we have to, it is not about in children, because it is not only about caring for them. Your diagnosis has to be right. So your diagnostic processes, whether it is AI driven or this one driven, the diagnostic tools have to be correct so that we make a proper diagnosis. And after making a proper diagnosis, we should have a point of care diagnostic test where we can give immediately the parents or the caregivers the appropriate or the right disease symptoms, or what we expect the disease process to be, the outcomes, the prognosis, all that. Then it comes about all the once they get admitted, medication safety, prevention of healthcare associated or hospital related infections. These have to be tackled. All these are all data driven. Now we are having a lot of data, so we can make processes and tools which integrates both technology, digital technology. Then comes, if you want to follow up these children later, we can have tools like telemedicine, teleconsultation. From the healthcare point of perspective, there should be a lot of emphasis on research, because as we do more and more research, the quality will definitely improve. And for each person, there should be time for improving their own quality, own standards, own knowledge. This can be this one by attending CMEs, conferences, having points, and most importantly, because of all these augmented or virtual reality, the simulation-based programs will definitely come into force. So, if we have a simulation-based program, it is just like the pilots who are learning aeroplane flying. So, with lot of simulation they learn or achieve great skills. I think here also, with the AI driven or augmented virtual reality based tools or technology, we can also improve our skills.
Definitely, sir. I second this thought. With this, since we are talking about the safer care and quality care, the parents are the one who are the primary caregivers when we talk about the children. So for them, I want you to tell them how they can get involved in promoting safe care for the newborn or the children or till the adolescents, because that is also a very important age when we should look into that, you know.
Uh, First and foremost, I'd say patient safety is not a hospital problem or a healthcare problem. It is a societal problem. So basically, anywhere or whichever field we are working, it is always a teamwork. So this team has to involve the healthcare providers, the doctors, the nurses. It has to be the parents, the caregivers of the child or the son, the communities, healthcare workers, the policymakers, the NGOs. So we have to include everybody. The parents and the caregivers should learn about newborn care and safety by various methods, whether it is pamphlet based or counseling based. And this has to start, but the newborn period, I don't think should start after the childbirth. It should start antenatally by counseling the parents or the mother and father even before conception. Next is about vaccination, importance of vaccination. We know that vaccines are there, but only vaccinations will help. So just by having the vaccine will not help you. Vaccinations are there. There are a lot of anti-vaccine lobbyists around, but I think we should get over that, get over all the myths. Then hygiene and picking up early danger signs. So if we can help the parents to pick up these early danger signs, they can approach or they can get good quality care much earlier when the disease process starts. Coming to the community, they should advocate for infection-free, pollution-free, or a smoke-free play. This one, and because we are talking about deliveries, I think every parent should be asking for a proper birthing environment or a proper birthing place for a safe delivery, and where this can be, all this is possible. Coming to healthcare workers, accountability and continuous learning has to be ingrained into them. Apart from research and learning process, whatever, whether it is simulation based or attending say, conferences, I think this learning process has to continue. For the policymakers and the NGOs, I think it is high time they start investing in rural healthcare, staff training, and for safe delivery infrastructure. So patient safety is all about teamwork, I think.
I second that thought, sir. Again, as a pediatrician, if we say, what's the very first step you take to make sure every newborn receives a safe care from the start?
Uh, like what I said, we should all remember that it all starts antenatally. So I think even if before parents start thinking about pregnancy, they should be counseled about the whole thing is, because now single child families are there, the single child norm is there. So every child has got a lot of importance to play. So it should not, people should not think that only after childbirth we should start much earlier. We should look at the mother and fathers, any problems are there, tackle them, then only start thinking about conceiving and having a birthing in a proper place where all the infrastructure is there with every possibility. So after the or the place of delivery should have everything in place, right infrastructure to promote natural or normal vaginal delivery, skin to skin contact, zero tolerance for separation of mother and child, early breastfeeding, resuscitation readiness, thermal control, prevention of infection. All these have to be there, and all these can be done only with repeated counseling of the parents and telling them these are the things are possible and these are the things which can go wrong. And once we build up a trust with the families or with the parents, I think everything will go accordingly as planned.
Agree, sir. I was about to ask the same thing, like how parents and caregivers actively contribute to making a safe care. So now we have the answer how it can be done. So before we conclude, sir, I would like you to tell our viewers and listeners a small message in conclusion.
Small message is learn to be informed. uh, like what I said, it is a societal responsibility. It is not a hospital responsibility to give quality care. Child safety in the ward has to be looked after not only by the healthcare worker or the parent who is there in the ward. It starts much earlier by giving them a proper environment where there is a lot of safety and security. A lot of the government itself has got a lot of thoughts and process about early childhood development, and they have a lot of schemes, a lot of policies to make sure the quality for all these things are there. The Muskan, the Lakshya things, policies of the government is there. So all that we need to know do is be informed. There is a lot of data, there is a lot of knowledge, a lot of evidence-based medicine is there. So from my personal point of view, it is the mobilization of the resources what we have to make sure that every child is born in a proper place, in a proper way, in a proper time, with proper infrastructure. I think that will go a long way to have a healthy child who will become a fruitful and healthy adolescent or an adult later on in life.
I agree, sir. Thank you so much, sir, for joining us today on this special episode of the Spark podcast on the occasion of World Patient Safety Day with the theme of patient safety. From the start, every child deserves safe care. We hope this conversation has highlighted the importance of safe care. From the start, every child deserves the safe care, quality care for every newborn and child. Let us all work together, the healthcare provider, families, and community, to make healthier, safer future from the very beginning of the life. I am Dr. Sonali, scientific editor of the Spark Kaho. Thank you for listening.
Thank you.